Ready to level up? Chumba Casino is your playbook to fun. It's free to play with no purchase necessary. Enjoy hundreds of casino-style games like bingo, slots, and solitaire anytime, anywhere with fresh releases every week. Whether you're at home or on the go, let Chumba Casino bring the excitement to you. Plus, get free daily login bonuses and a free welcome bonus. Join now for your chance to redeem some serious prizes. Play Chumba Casino today. No purchase necessary. VGW Group. Void where prohibited by law. 18 plus. T&Cs apply.
So hi, everyone. Welcome to another episode of Unpacking Possibility. I'm your host, Tracy Stein, as always. I'm so happy to be here with you. You are going to learn so much from our guest today. She's Dr. Tracy McCarthy. And I'm going to tell you in a moment why what she has to share with us may change your life and your health for the better. So, Dr. Tracy McCarthy is a physician. She's a psychiatrist. She's board certified, and she's also certified by the Institute of Functional Medicine. She's got over 2 decades of experience. She'll share some of what she's learned with us today. But Dr. McCarthy is the creator of the Natural Mood Solution online program and the founder and medical director of Dr. Tracy McCarthy Functional Medicine. Now, functional medicine is something you've probably been hearing about quite a lot online, on social media, and so forth. So we'll delve into that. But Dr. McCarthy is a wellness thought leader, and she's dedicated to helping adults in her practice who are suffering from things like depression, anxiety, brain fog, fatigue, digestive issues, and hormonal imbalances, and more. And you'll learn today a little bit more about how and why those things are all likely related. So Dr. McCarthy's approach really focuses on treating the underlying causes of a lot of the symptoms and syndromes that you are experiencing. Likely, most of us are, I think, these days. But some of them include things like mold toxicity, microbiome imbalances, and nutrient deficiencies. So without further ado, I'd rather let you talk about your work, Tracy, but welcome to the podcast.
Thank you so much for having me.
It's great to have you here. There's so much percolating in my mind. I'm going to try and restrain myself because, you know, as a psychologist who's worked primarily with medically ill people over the last many years now, I can't tell you how often I've experienced resistance from other psychologists, psychiatrists, primary care providers, and so forth, in trying to talk about some of the things that thankfully you're talking about and have expertise in. So where should we start today?
It might be helpful to explain how I got here, I think, because it sort of explains why I do what I do and kind of the point of this work. Would that be helpful?
Yeah, absolutely.
Yeah. So I have a very conventional background. I went to allopathic medical school, which means I'm a MD, medical doctor. And I was very naive when I went to medical school, and I thought I was going to learn everything I need to know to help people with that approach. And, I really enjoyed the first few years because it was all about learning how the body works and then learning what we call pathophysiology, like what's going wrong. But I became frustrated over time in my training because it really started to boil down to looking at a symptom cluster, and saying what diagnosis matches that, and then matching that to a pharmaceutical, and that being often the end of the thinking and the conversation. I was always wanting to know why. Why does somebody get this? And, my psychiatry training saying, why does someone get schizophrenia? And I was usually met with, well, we don't know. And then that was the end of the conversation. And so that was disappointing and frustrating. And then fast forward to where I'm now, working as a psychiatrist with pretty severely ill patients who are in a psychiatric hospital. And people are frustrated because they're looking at taking these medications for the rest of their life, or, they may be partially helped by the medication, but it's not really getting at everything, or they're often on many medications and having lots of side effects. And other than options for therapy, there's really nothing else that's talked about. And, I was getting very frustrated with this too. It didn't feel like why I had gone into medicine. It was great when the meds worked, but that wasn't always the case. So I, fortunately, around this time, came across the work, the huge body of literature and the research on the role of chronic inflammation in so many conditions. Now, at this point, it was kind of separated from psychiatry in my mind. I was reading about autoimmune disease and, GI issues. But I was really fascinated by this and hearing stories of people changing their symptoms by changing their diet. And I was blown away by this now seemingly very basic thing to me, because I'd never learned any of this in medical school. And I really went down the rabbit hole and got, just dove deep in the education of this, ultimately getting my training through the Institute for Functional Medicine. But first changing things in my own life and just feeling more energized, less bloating, these basic things that I didn't even realize were symptoms I was having until they got better. And really started to wonder, gosh, could this apply to psychiatry? Because I wasn't seeing that example around me. But over time, I did see some examples of that and realized, as you train in this approach, this mindset shift that is this root cause functional medicine approach, you realize everything is connected and everything causes everything, basically. Just depends on who you are and your individual genetics and experiences and exposures in terms of what symptoms you're going to have. So that was a game changer for my whole mindset and really shifted my whole focus. I ended up going into private practice so that I could actually work with people in this way, because I couldn't affect that kind of change in the hospital. Both are very useful, but there's so much more that can be done. And in some cases, you have to do the other thing. Let's give an example of like a vitamin B12 deficiency. Well, a medication and therapy aren't going to fix that, No. So that's how I ended up here. And that's why I do what I do.
So for people who are just listening, I made a hand gesture, which I don't normally do, like the yay and mouth the word thank you, because B12 is one of those things that I've been reading about and talking about for a really long time. And I'm so glad that you brought that up first, because it's one of the easiest things,
right,
and most affordable things for people to address.
Yeah, so simple. And it can be a huge factor for certain cases.
Yeah, absolutely. And maybe we'll get back to that in a little bit too. And if you have any cases you feel like you can share, great. And if not, I completely understand. So, you've painted a bit of a picture about functional medicine for mental health and what that is. Absolutely. We don't hear about that as much as, for more general health or bodily health. I listened to one of your other interviews, and you said something I thought was so succinct and important. And it was that in medicine, and honestly, in mental health as well, things are so siloed.
Yes,
there is such a split, and it's a very artificial split. I hope I don't unload too much in this podcast, because most of the people I, have on aren't talking about this specifically, even if they're talking about health. And, I feel like people treat sometimes their theoretical approach, their theoretical orientation to mental health as like a religion in the worst possible way. And it really takes some humility and open-mindedness and intellectual curiosity and a desire to help that's bigger than the ego to look beyond our training or our philosophies that we've come to adore.
I'm so glad you just said that, because that ego, that humility aspect is the key. And I feel like when I moved to that, and they realize that we don't know, there's so much we don't know. And guess what? Like, we don't have the corner on knowledge here in like allopathic medicine. There's all kinds of knowledge all over the place that different people have and can bring. And then there's so much we don't even know, that no one knows, that we're still discovering. And when you're in that place of humility, then you can have exactly what you're talking about, that open mind. And then I have been amazed by having that view, having that perspective now in my life. These wonderful tools and approaches come to me, like that I learn from others. I'm introduced to them. And because I'm open, I can see the value. I can bring this to my practice. I mean, I have gone down a fascinating path of doing things I would have never done before. And I'm so grateful because they've been so helpful to patients. But if I had been closed-minded and thought I knew everything, I would be helping no one. I mean, it would be just so limited. And I think that's the key issue in medicine right now, is the arrogance.
It's so hard too, because, I had background in looking at things very integratively for a long time. And that's why a lot of people were referred to me. And, and again, what I don't know is so much more than what I do. And I'm just going to put that out there. But, I know you've talked about things that I've thought about for a long time, is that if the body is unwell, it is very hard to have good mental health. And a lot of times people would come in and say, well, of course I'm depressed. I have rheumatoid arthritis, or I'm dealing with cancer pain, or all of these other things. But I'm going down a little bit of a rabbit hole here. But you've talked about things like nutrient deficiencies, microbiome imbalances, mold toxicity is like a whole other thing. But it's like you can be dealing with an illness, a physical illness, and have mental health issues and still make changes to improve the way somebody feels in mind and body. So I'm wondering if you want to talk about that more specifically, some of the things you see that are often out of balance and some of the things that commonly you do address.
Yeah, I'm happy to. And I think just to kind of comment on what you were saying about, you can be like, well, of course I'm depressed because I'm dealing with this pain or this inflammatory condition. Yeah, the situation can be depressing, right? Or being in pain can be depressing. But on top of that, and I think this might have been part of what you were alluding to, is that there can also be like inflammation in the body related to that illness that is causing the depression. It's not just the situation and the psychological impact of that situation, though that is of course a factor, but there's that physiologic piece as well. And so, yeah, the commonalities, I mean, the common word really is inflammation. That's like the pathway through which all these numerous triggers kind of manifest have their action, and then they show up in different people in different ways. Like I said, because of their biology, their individual biochemistry and genetics, that you can have a whole host of triggers that two people can have the same sort of root causes, and it can look very different in terms of the symptoms they're having. Just like you can have two people with, for example, major depressive disorder, and yet have different clusters of root causes. And so that's really an important concept in this whole functional medicine approach. But that common sort of vehicle pathway is inflammation. So much is occurring via that. So that's really where we can exert our leverage. And we know that some of the biggest levers on inflammation are actually things like what we're eating every day, how we're sleeping, even things like our relationships. Are we laughing? Are we in community? Are we getting hugs? These things really matter because they affect our physiology. So that's the big thing I see. And then the big factors influencing inflammation are, in the dietary realm, it's going to be really pro-inflammatory processed foods. This won't be a shock to anybody probably to hear, but those are a big deal. And we can really, really reduce inflammation just by shifting the majority of what we're doing most of the time. It's not even about, being perfect, right? It's never about that, actually. It's about, what am I doing most of the time? Am I moving away from, packaged foods and sodas and sugary things and flours and, and moving into whole foods, clean sources of things that I've cooked, instead of had to, make out of a package. That shift alone will be huge. Making sure we're getting healthy fats instead of inflammatory fats, which I can certainly provide lots of details about what those are. But just big picture, those are huge factors right there. Those influence all the things you were mentioning, like microbiome. That's our gut bacteria primarily. It's also viruses and sometimes, other bugs in the gut. But whether we have beneficial, good bacteria working for us, or we have deficiencies of those and they can't help us, and we have overgrowth of inflammatory bacteria, that is hugely influenced by what we're eating every day. So we can shift it a lot just by changing our diet and what we're feeding our gut. And then, of course, what we're eating is going to impact our nutrient status. How we're digesting is also, I would say, a really big one that is missed, that I see a lot when I start getting into testing with people. I do have some real, advanced patients come to me eating very, very well. They've already done that part. They've seen certain benefits and improvements, but they're still stuck in certain ways. And often they actually aren't breaking down those nutrients very well and absorbing them. So they still have a nutrient deficiency, even though they're eating well. So those are some, starting points about really common triggers. After that, it would be, I think, the toxins. You've mentioned mold, but it can be all manner, all the things in plastics, those parabens and phthalates you hear about. These are real problems for our hormonal systems, and it causes a lot of imbalance there. Heavy metals cause problems, of course, mold. So these are the really, unfortunately, very, very common issues that we're all dealing with just living in our modern world.
I love that you mentioned some of the chemicals and, everything from what packages our food to, the bottle for our medication or supplements. I don't want to get overkill, but it's totally true. Or the things that treat the fabrics of the clothing we wear, or personal care products. And I don't know if it's any one thing that is the thing or the combination of things. But, you mentioned affecting hormones.
Mm-hmm.
As a woman of a certain age, I can say that I did not fully understand when I was younger how quickly hormones can change how you feel and think. I mean, you can see maybe, I don't know how much people can tell, but like my brain feels not as sharp as it did 10 years ago,
Such a common problem. Yeah. Yeah. Hormones are powerful. And they provide an amazing buffer for all kinds of things like brain function and our immune function. And it's like we're just so much more sort of vulnerable to things when we don't have that same hormonal buffer. And so anything that's going to take those hormones out earlier or dysregulate them is a problem.
And the things like the toxins in our environment that impact hormones, even though that might be more gradual than, say, somebody who is now fully menopausal or postmenopausal, or someone who's had a surgery that has very quickly changed their hormones, still has an effect. Would that be fair to say?
Yeah, it would be for sure. And just for your listeners who are maybe kind of worrying and freaking out about every possible bottle and product in their life, I just want to say that take a breath, don't get overwhelmed. It's really like we can do some small things that add up to a big change. And we're not going to control every single one of those things, right? But we can do a lot. And making those steps to just use clean personal care products. Now there's tons of options. I mean, when I first got into this, there were very few like makeup lines that were okay, or, you had to really research. And now there's so many things available. There's a real market for it now and a demand. So we have lots of choices, but there's so many things you can do there just to sort of one product at a time, like clean up your house, what you're putting on your skin, what you're using for soaps, how you're cleaning. There's so many great options. And just doing that is going to really drop that toxic burden that your body has to deal with every day and has to process and try to remove. Or if it can't remove it, it might sequester it in your fat tissue and actually pack on more fat tissue as a place to keep those toxins, harbored and safe away from you. I mean, it can definitely part of people's weight gain issues these days. So many impacts, but there are things you can do. Don't get overwhelmed. One thing at a time, you can make a difference.
Definitely. We could do a whole show just on that. And I'm sure people would be very interested to hear about that. So if there's time today and you want to come back to that, please let me know. But other things that affect the microbiome, you alluded to, not having the best social connectedness. So stress, not having healthy relationships and the stress that causes, or loneliness, heavy antibiotic use over time. Are there things that people should be aware of that unbalance the microbiome, or ways that you recommend people balance it?
Yeah, I think some things people don't realize, things like ibuprofen is one thing that can impact your microbiome. So, just using that really only when you need to and trying to not overdo that. That's a good, simple thing. Feeding, just keeping in mind, feeding the microbiome. So what the microbiome wants is fiber and like the compounds that make vegetables and fruits colorful, this rainbow of eating. They are going to be able to utilize a lot of those phytochemicals, they're called, that are going to be sort of important for their growth. And then that's going to help you have a better microbiome working for you. So just keeping it in mind as you eat, It's like nourishing that is very, very helpful. Another huge culprit to beware of is glyphosate or Roundup. That really, really damages the microbiome. The sort of excuse on the part of big ag is like, oh, it doesn't hurt the human body. Well, it drastically hurts our microbes, and they do a lot for us. So that means, filtering your water if you're having like river water source, or, because it's going to be runoff from agriculture. Obviously, eating organic products that don't contain Roundup. These make a big difference. We see people very impacted, like people who live next to a golf course, for example, huge Roundup exposures. So, being aware of that can make a big difference as well. I would say that's a biggie.
Yeah, there was just a news article that came out recently talking about living within 1 to 3 miles of a golf course increases your risk, I guess, of Parkinson's manifold, maybe even 6 times. So, I mean,
makes sense.
Yeah. And I think, we're taking in toxins, not just from what we eat or wear, but what we drink, what we breathe. And again, we're not trying to alarm anybody, but thinking about the things we can do.
That's right.
To keep
what
us
we can
more in
control.
balance.
It's like what you're doing most of the time at home. That's where you want to focus.
I have to take a quick break, but I'll return in a few moments with more on Unpacking Possibility. Stay tuned.
Ready to level up? Chumba Casino is your playbook to fun. It's free to play with no purchase necessary. Enjoy hundreds of casino-style games like bingo, slots, and solitaire anytime, anywhere, with fresh releases every week. Whether you're at home or on the go, let Chumba Casino bring the excitement to you. Plus, get free daily login bonuses and a free welcome bonus. Join now for your chance to redeem some serious prizes. Play Chumba Casino today. No purchase necessary. VGW Group. Void where prohibited by law. 18+. T&Cs apply.
So there are things to avoid, a lot of chemical exposure, trying to avoid non-organic food and make sure your water is clean, but also things you can introduce, like you said, fiber and healthy vegetables. Other things, dietary supplements that help reduce inflammation and or balance the microbiome. Your favorites for mental health? Yeah,
there's some real key ones that most people don't have enough of. So they're pretty easy to talk about. I would start with magnesium. That is a mineral that's really lacking these days in our food supply due to soil depletion of magnesium. And also we use more magnesium when we're dealing with a higher toxic burden. So we need a lot. There's a lot of forms of magnesium, and you want to pick a form that matches sort of your bowel function, basically. So, if you are running on the slow side or constipated, not having a bowel movement every day, a form that's great is magnesium citrate. If you don't have that problem, magnesium glycinate is a wonderful form. It helps with anxiety. All of these magnesiums help with your sleep quality and many, many biochemical reactions in the body. And there's other forms too, malate, taurate, L-threonate is one that's really great for the brain. But any of them are going to be helpful. Magnesium oxide is the one to watch out for. That's extremely laxative. So be careful. Just know that. But yeah, magnesium is a biggie. And then next thing I would say is omega-3s. So these are the fats found in particular in certain fish. Very, very hard to get from any other source. Even though people talk about flax or chia, we convert very, very little of the fats in that to omega-6 fats. So we really do need to supplement or eat the right fish. And you've got to be careful with fish that you're not having a lot of mercury exposure. So example of a good source would be sardines, which most people don't think about or want to eat, but can actually be kind of like eating like a tuna salad. You can make a sardine salad, kind of tastes the same. Salmon, wild-caught salmon is a really great option. And then there's some other choices too, but those are two good ones. And then you can supplement with a high-quality omega-3 fish oil. You got to read the labels on those. Sometimes the fish oils have very little omega-3s in them and definitely aren't high quality. And that's a problem because then they can have compounds that aren't good for you and toxins in there. But a high quality one can be very helpful. And let's just talk about why they even matter. So omega-3s and omega-6s are called essential polyunsaturated fatty acids. Essential meaning we have to eat them to get them. We can't make them from other fats. And we need them both. And they are balancing our inflammation or our immune reaction to things. So omega-6 fats are like the accelerator on inflammation. Think of a car. They're like the gas pedal. And you need that. If you get an infection or you get an injury, you need to turn up the inflammation to respond to that. And then the omega-3s are like the brakes. And we need to then be able to put the brakes on and say, okay, that infection's gone, and not have just runaway chronic inflammation. But that's what a lot of people have, because in America, most people are driving around pedal to the metal and no brakes at all. It's very scary. And the reason for that is, you can imagine why you might not have enough omega-3s based on the sources I was describing. But most people are overloaded with omega-6s because they're in all of these cheap seed oils, industrial seed oils, we call them, like canola oil, soybean, corn, peanut, tons of those. And then every product made with those, which is like every cookie, every chip, every, packaged thing, every salad dressing, unless you're picking a very few specific brands that actually have avocado oil or only olive oil. Mayonnaise. I mean, it's ubiquitous. Every fast food is going to be fried in these kind of oils. So you have to, and this is why I say what you do at home really matters, because you're not going to be able to fix all that everywhere you go. But what oils are you cooking with? Reduce that omega-6 intake. And that's where getting rid of a lot of that processed food, that's part of why it makes such a difference, is getting those bad fats out. So again, you want breaks and you don't want to be pedal to the metal. You need balance there. So omega-3s are a big one. There's a couple others I would say. B vitamins in general.
Definitely.
Especially the B12 we mentioned, and folate, huge one for mood and for detoxification. And then there's a bunch of other B vitamins that are very important. So a B complex is a great thing to be supplementing with, or a multivitamin that has, contains a B complex. And then the last thing I would say is zinc. For when we're talking especially about mood and brain health, zinc is a really common one that people are low in. I mean, I test all my patients for zinc and copper. Zinc is almost always low, and copper can get kind of high because zinc will balance it out. So supplementing with some zinc, you want to stay under 50 milligrams a day if you're not under medical supervision, because it can be too much. But those are some real basics that can really change your nutrient status.
And they're all largely affordable. I would think that the omega-3s will be the most expensive. I'm thinking, I'm not trying to hawk a brand. They're not a sponsor of the show, but like Nordic Naturals, I know is molecularly distilled.
Mm-hmm.
So,
and easily available at a lot of stores.
Yes.
Yeah, that's right.
But that will be more expensive than like a B complex, but all still worth it.
Yes, I think they're critical. I mean, to have that somehow, either from your food or from your supplementation.
And something that I thought was so fascinating that you mentioned in another podcast is that and I did not know this. It makes sense now that I think about it, but you said that if you have enough omega-3s, you are less likely to have a concussion.
Oh, yeah.
If you have a head injury. Well, that's like remarkable. And I'm saying this as somebody who has had a concussion. So huge.
Yeah. It's basically like, what's the inflammatory status of your brain when you get this injury? That's why it matters. Like what's the recovery going to be like? What is your body's ability to deal with this? So, there's a wonderful concussion protocol that Dr. Lewis created that's about like high dose omega-3s after concussion, but making sure you have a good status going into any injury. And of course, you never know when that's going to happen. So it's just a good preventive. And of course, it's helping the whole rest of your body. It's helping that chronic level of inflammation be under control. It's helping your gut. I mean, these omega-3s are in the membranes of all your cells. So it helps them be like fluid and flexible in an important way. So that's going to help with communication between neurons. I mean, it's just profound.
Huge. I was wondering if you might want to talk also about things like blood sugar and mental health.
I love talking about blood sugar.
As one does.
Well, okay, I might be a little nerdy here, but I do have to say that to me, it's the low-hanging fruit, like for Americans. Like if you can work on your blood sugar, you can change so many things about your health and just how you feel every day. So most people are riding the blood sugar roller coaster is what I usually say. Up and down all day. They have no idea because they're not testing this, of course. And and they're not tuned into what that might feel like. But, the standard American diet is like very high carb. Most people don't have enough protein and definitely don't have good fats and often not enough fat. And so that protein and fat really balance out the carbohydrates when you're breaking down and absorbing your food. So when you eat carbohydrates, so I'm talking about, sugars or starches, breads, potatoes, all of that, your body has to release insulin. That's the hormone made in the pancreas that's going to allow that blood sugar to go into the cells. So take it out of the blood and into the cells, and to store fatty acids in the liver. It's like a storage hormone. It's like packing the sugar away. It's like the idea is like, hey, right now we have lots of food. It's, the blood sugar is up now because we've absorbed it. Let's pack it away so that later when we're not eating, we have energy. And that's how it's supposed to work. But because of toxins and because of our very high carb diet, we get something called insulin resistance, where it takes more and more of that hormone to unlock those cells and let the blood sugar go in. So what happens is we get this big spike of blood sugar while you're starting to pump out the insulin, and it's not working. And then finally, that huge amount of insulin kind of kicks in. Now the blood sugar plummets because it's all leaving the blood and it's going into the cells, and you end up with what we call a reactive hypoglycemia. You have this low blood sugar now. This is where people feel like garbage, like they feel anxious or tired. This is like hour after you eat and you want to take a nap, or now you're shaky, or now you're anxious. So this is that blood sugar roller coaster. You went up and then you go down. And every time you go way up, it's triggering inflammation. It's sticking sugars on different parts of your tissues that is not healthy for them. It's damaging your blood vessels, your brain. And then whenever it goes down, that's creating a major stress response. In fact, when it goes low enough, fast enough, you actually release adrenaline to rescue your blood sugar. And that's a lot of times where that anxiety is coming from, is that release of adrenaline. So this is happening all throughout the day for lots of people, and it's even happening at night for a lot of people. So this can be a totally unrecognized cause of waking up at 1, 2, 3 a.m., being wide awake because your blood sugar dropped, your body released adrenaline, that woke you up. You might not even feel anxious, but that's what's going on. You're alert, and it can take you an hour to fall back asleep. So this is a major, major problem, causing tons of inflammation and damage in the body and a lot of suffering. And for some people, it's the major source of their anxiety. So addressing this is a game changer, and you can do so much just on your own to fix this. So I mentioned already the fat and the protein, having adequate protein at every meal, having some fat with every meal. And guess what? Eating the protein first, having several bites of protein before you eat your potato or, the bread or something, that's going to help balance that out, help slow down that blood sugar spike. So if it's slower, then it's going to be lower. It'll be more of like a flat hill instead of a sharp peak. That's going to help quite a bit. And for some people, they're going to feel a lot better if they actually reduce the amount of carbohydrates they're eating and up the fat instead. Some people's insulin resistance is pretty significant, and they really can't tolerate that many carbs anymore. And that's why a low carb diet can be so great for lots of people, or even a ketogenic diet, which is very low carb. This all depends on where you are on the spectrum of insulin resistance. So this is not one size fits all, but you can experiment and see, where do I feel best? And this can really even out those blood sugar highs and lows, can really improve your sleep. And by the way, improve all your hormones, because all of your sex hormones like estrogen, progesterone, your thyroid, all of these are impacted by what's going on with blood sugar and insulin, and then the stress hormone cortisol, which is so impacted by these blood sugar swings. So like one of the best things you can do to balance out your hormones is balance out your blood sugar. Like I said, it's like the low-hanging fruit. I could talk forever about it. I'll stop now, but it's so important.
It is so important. And I think embedded in what you're saying too, because I'm imagining people listening at different levels of understanding about nutrition. And even though there's so much out there about it, is that the processed food, will have things like that just are pro-inflammatory, but also low fiber, high carbohydrate, low protein, maybe some other kind of crap in there. And listen, I'm just disclosure. I've been vegetarian for a long time. It's very hard for me to get food that has enough protein. Oftentimes that means me throwing my fake chicken in a skillet. And I'm aware that that is not a great food, even though it is marketed as such. So for me, something like tempeh is going to be better than something really processed. But I think a lot of people don't, I think you explained really well why processed foods do such a number on us.
Yeah, and you're absolutely right. It's all those reasons you just gave, It's like low quality, pro-inflammatory, but high carb, low fiber, low protein. It's all of those reasons.
Yeah. I mean, we could talk about this for a lot. I'm going to be mindful of your time because I know you're a super busy physician, but there are other things I wanted to kind of ask you.
Sure.
And we can go over them or not, but caffeine and mental health. Any thoughts on that?
Yeah, I do. As someone who's quite sensitive to caffeine, I'm real aware of this one. So half of the population is really a slow metabolizer of caffeine, but I don't think half the population realizes that. And so, with anxiety, for example, that's one of the first things to check is caffeine playing a role? It may not be, but if you're having coffee every morning or drinking soda, we really want to get rid of the soda for many, many reasons, but it's coming off of that, and you might need to taper because you don't want to get a headache if you're really used to the caffeine, but you need to do a trial of a few weeks off of caffeine and just see how you feel. Because for some people that is triggering a fair amount of anxiety. It's also, people don't realize that slow metabolizers can have caffeine in the morning and their sleep can be impacted. People usually only think about it if it's like afternoon or evening, but it can be much worse than that. So you just have to do an experiment. And that's actually how I always encourage patients to think about anytime we're eliminating a food or looking to see if it's a trigger. This is just an experiment. Just be curious. We're not deciding what you're doing for the rest of your life. You're just going to try this and see what you learn. And that's usually very clarifying. Like maybe caffeine's fine and you're not sensitive, or maybe it is a big issue, but you just need to know. And you really don't know till you test it out.
So well said. I feel like this is like the lightning round. And again, I'm trying to get a bunch of things in that I think are really, really important to go over. 100%. And also guilty of doing too much caffeine. And, it does create this vicious cycle of not sleeping, daytime fatigue, having too much caffeine. Yes. And, so I just want to let people know I get how hard that is to taper off.
Totally.
So another thing that people talk a lot about today, it's, you'll see it on Instagram and other social media, and it's really important, I think, is mitochondria and mitochondrial health. And certainly there are supplements that help mitochondrial health. I want to tell you also why I'm asking about that, not just because it's trendy, but as somebody with long COVID, I've been looking into things for a while about, how can I feel like I have normal energy, forget great energy, or better cognitive function. And so I don't know if you want to leave the long COVID out or tie it in. I don't know how many people come to you about that, but certainly just mitochondrial health generally. Why is it important and what can we do?
Yeah. So for people who don't know, mitochondria are the little organelles in our cells that make our cellular energy, which is called ATP. So they are the little factories, the energy powerhouses. And if they're not working right, you can imagine nothing's going to work right because we need energy for every little function in the cell and in the body. Mitochondria are very, very sensitive to toxins. And so there's a lot of ways they can get damaged, and they can actually go into a sort of a hibernation mode. This has been described by Dr. Robert Navio. I encourage people to read about this cell danger response, but it's very, very interesting, where they can be sort of shut down in an effort to help protect the whole system. But you can imagine is one of the ways that people can experience chronic fatigue. And we know chronic fatigue is linked to like more than 50 toxins. I mean, the role of toxins with mitochondria are huge. And I would put high blood sugar in that list of toxins. Definitely not helpful for mitochondria. So, thinking in terms of what do mitochondria need for health is a really good thing to have kind of on your mind. And just like I was talking about keeping in mind your microbiome, am I feeding it? The same is sort of true for mitochondria. Like first, am I poisoning my mitochondria? Let's make an effort not to do that. And then also, what do mitochondria need? Well, this is where those B vitamins come in that I was mentioning. I mean, they're used in a lot of places in the body, but they are a critical part of the basically assembly line that happens in the mitochondria called the electron transport chain that is making the ATP energy. So you need your niacin, for example, for that. You need these B vitamins. You need CoQ10 for that. You also, by the way, need oxygen for that. And there's lots of people out there who aren't getting enough oxygen because they have undiagnosed sleep apnea. So that's, why you're experiencing daytime fatigue is like you're not getting enough sleep and you're really impacting your mitochondria. So it's fundamental. Like, do I have air at night? So there's a lot to think about with mitochondria and making sure that they are having everything they need to function well. And if they've gone into that, cell danger response, then what are the threats that are keeping them there? I think that's part of what's going on with long COVID is that, the brain, at least the limbic system in the brain that's responsible for looking for threats in the environment is still perceiving a threat from the presence of that spike protein or it's not got the memo that the COVID's gone, so there's something that needs to be done differently in the brain, like a brain retraining. Yeah, mitochondria play a huge role.
Thank you so much for addressing that because I think it's going to be something people are hearing more and more about. Mm-hmm. But I think it's something that in general is not well understood by people not in the medical profession or who don't have a science background. So I think it's so important. And I think that was a really clear description. So thank you.
Good. I'm glad. Yeah, they're important.
Absolutely. I want to be mindful of your time. What is it that we should be talking about that we have not yet? Other things that you think are really like, if I were going to say, this is the thing you should do more of or do less of, or this is what I really want people to know.
That is a great question. I mean, I think if if people are like me, then they can get easily overwhelmed. That's one of my kind of things I'm always working on with my mindset, and I think, for a long time, like toxins fell into that category. I mean, even as I did my IFM training, Institute for Functional Medicine training, that detox module was like the last one. And I didn't want to go to that course because I was going to be so depressed. I felt like hearing all of that. And so I just want to say that one of the things that I think is just so critical, and I hit on this earlier, but I really want to emphasize this, is that you want to baby step your way into better health. That's what I have done. I'm still, of course, on that journey. We're all always on the journey, but it adds up. So little things that are, you want to do a change that feels doable, make that a habit. When it's easy and you don't think about it anymore and it's automatic, now you can add the next thing. But, whether it's like cutting out soda and moving to like sparkling water, or it's, starting to, maybe there's some meal that you'd like to start cooking and you figure out one or two easy recipes and you stop just going out for that meal. Or it's going to bed earlier and really trying to be mindful of that bedtime, or it's getting out and getting some light exposure in the morning to help set your circadian rhythm and help all your hormones, by the way, by doing that. One habit at a time. We sort of we overestimate what we think we can do in a day, or whatever the phrase goes. Like we think we can do so many things and then we get upset at ourselves when we don't, but we underestimate what we can do in a year. So if you just kind of make a list of here's the things that I would like to change, I'm going to pick one, break it down into a baby step, work on that. That is how you dramatically change your health. But it's one little baby step at a time. So I just urge you all listening, to not pile on yourself. Don't feel guilty about anything you're not doing. Don't be overwhelmed. Just pick something easy. Maybe I've mentioned something here today that sounds like I could do that one thing. Maybe you need to change your facial moisturizer. Start there. It's like These things really, really add up, and it's amazing. So little baby steps, but they're really big. And I just think that mindset will serve you so well if you just are gentle with yourself and, don't be critical and self-judging, but actually be kind and do one thing at a time, but stay with it. because you will get there. You will get to feeling better. You will keep reaping the benefits of that.
Oh, I love that. So true. And I love that, it gives people the opportunity to experience success.
Mm-hmm. We all need that.
Little bits every day. Yay, I remade this favorite meal of mine in a way that's healthier. I changed my moisturizer. And it's like, you can check that off. So that's great.
That's right. And that's how we should be measuring our progress too. There's a great book I read called The Gap and the Gain that really highlights this. I just love that book because I was a mindset shift I needed, which is like, you want to measure backwards. Like, where was I a year ago? Okay, look at what I've accomplished. Because we're always thinking about what we haven't done yet, what we need to do. And then we can feel really bad about it and sometimes not even make forward progress anymore because we're so overwhelmed about it. Yes. And honestly, often we're picking some kind of horizon that we can never reach because there's always more we can do. Instead, it's like, look back and say, okay, hey, I came that far. What's the next thing I'm going to do? Because when you look back and see what you've done, you're inspired to take the next step. It's amazing how it makes you feel.
100%. You're like running the marathon step by step.
That's right. Yes.
So true. So Tracy, for people who want to come see you and have a more personalized kind of assessment of how they're doing and how you can help them. Because like you said in the beginning, it's not one size fits all. It's really individual, even though there are many things that generally will make a difference and apply and that we can all keep in mind. What is the best way for people to come and make an appointment with you and your team?
Yeah. So I can see people who are California residents in my practice. And to do that, you could go to drtracymccarthy.com and click on our discovery call link. You can schedule a free discovery call with my team and find out if it's a fit to work together. And in my online program, Natural Mood Solution, people can live anywhere. That's an educational program goes way more into detail about things we talked about today that you can implement on your own. And that's the thing I think is also important to know is, there's so much foundational stuff one can do before ever seeing a provider. And, if you go into a provider having done a bunch of that foundational work, your progress will go really fast because you've already laid that foundation. Now they can look for those individual pieces of the puzzle that need to be done with testing.
I love that. And I so appreciate your taking the time today. I really enjoyed speaking with you. I think everybody's going to learn a whole lot and start feeling better right away.
That's what we hope. That's the goal. Well, thank you so much for having me. I've really enjoyed speaking with you as well.
Oh, terrific. Wonderful. This has been another episode of Unpacking Possibility. If you enjoyed the episode, and I know you did, please remember to like, share, follow, leave me a comment. Let me know what you think. And as always, until next time, be well.